I'm Dr. Nour. I'm one of the faculty at UCLA Health with a joint appointment in both neurology and radiology. My specialty in neurology is vascular or stroke neurology, and in radiology, in my capacity talking to you today as an interventional neuroradiologist. What I'd love to do today is tell you a little bit more about carotid disease. What are the carotid arteries? You may hear this word, people having problems with their carotid arteries. These are arteries that start all the way at the base of the neck. And these arteries are paired. We have one on each side. And these are the blood vessels that help deliver oxygen to not only the tissue of the face and scalp and head, but also to the precious brain tissue. And here is a demonstration of how many small blood vessels can feed the face and the head, and also the carotid artery as it courses through the tissue of the brain and gives it that vital oxygenation and blood flow. What happens when the carotid artery becomes diseased, especially in the segment in the neck? So that's what I'm talking about today, carotid artery disease in the neck, or as we call cervical artery disease. And here, what you can see is that there's now narrowing in the flow in red in the blood vessel of the carotid artery, and that narrowing is caused because of accumulation of plaque. That happens over time. And when plaque is accumulated, you see now a more narrow stream of blood. That is limiting how much blood flow the brain is getting and what the function of the brain is. But also, not only is it dangerous because it limits flow, it's also dangerous because part of that plaque can actually break off and go block a blood vessel in the brain and cause devastating stroke. In about 10 to 20% of strokes that are caused by a lack of blood flow to the tissue of the brain, it is because of disease in these neck carotid arteries. And the risk of the pathology, or the risk of this causing disease, has to do with how narrow your vessel is. And in 50% of patients who have had, unfortunately, strokes because of carotid disease, what they found out is that about 50% of them have had symptoms prior to that, or warning symptoms. And the plaque can, again, send clots up to the brain or just narrow the flow in general to the brain. And as you can see in this cartoon picture here, you see an open and narrow, open and patent blood vessel, or open blood vessel. And here you see the vessel narrowed or partially blocked by that plaque. There are things we can control and things we can't. So our genetics we can't control. Some people are more predisposed to having disease in the cervical portion of their carotid, or the neck portion. And in others, it's the modifiable risk factors, okay? So what things can we do and change to help us that will not progress, allow the disease to progress? So one that allows the disease to form and progress is smoking, cigarette smoking, high cholesterol, high blood pressure, uncontrolled diabetes, obesity, or in other ways, injuries to the blood vessel. And I'll give you an example of an injury to the blood vessel. For example, somebody who had a head and neck tumor, who had radiation beamed to the side of the neck, that can damage the lining of the blood vessel, and that blood vessel in healing will end up narrowing and causing disease in the same manner. And then now we have to understand what to do about it. And the modifiable risk factors we talked about, we can change. And for these factors, eating better, exercising, working on weight reduction, stopping smoking, if you're diabetic, controlling your blood sugar, all of that is very, very essential and important. So you don't allow the disease to keep going, to progress and to get worse. And realizing the signs and symptoms of stroke. So don't miss out on the warnings. And the acronym we like to use is called FAST. F stands for face, A stands for arm weakness, S stands for speech difficulty, and T is time to call 911. And there's a different use of this acronym called B-FAST, where B stands for balance problems and E stands for eye problems or vision problems. And in fact, in carotid disease, oftentimes the very first presentation for patients will be transient or permanent loss of their vision. And how they usually describe that vision loss is that they say, all of a sudden in one eye, it seemed like the blind went down and all I could see was dark, and it may return. And that's because a part of that plaque or part of that clot here in the neck, where the blood vessel has been filled with plaque rather than having normal flow, will break off and actually block the blood vessel feeding the eye temporarily. And in stroke, we know now that still in the United States, almost 800,000 people have a stroke per year. And every 40 seconds in the US, somebody's having a stroke. So how do you detect carotid artery disease? If there's suspicion, if there are these warning signs, what do you do next? There are 3 different types of modalities or different types of imaging you can get. One is a carotid ultrasound. That's the simplest and least invasive, where they put an ultrasound probe just on the neck and are able to detect how fast blood is flowing. If blood is flowing too fast, it indicates that perhaps there's a area of narrowing. The other way is to look at the structure. And looking at the structure, you can get it through an MRI angiogram. Angio means blood vessel, gram means a picture. So this is taking a picture of the blood vessels. And here you can see whether or not there would be narrowing in any of the blood vessels of the neck, but also of the brain. And very similar to this, with CT technology, you can get that same view. And here, a CT angiogram is showing that here's the common carotid artery we talked about, which branches into 2. The main one, the internal carotid, which feeds the brain, and many branches of the external carotid, which feed the head and the face. And what you can see here is a very tight narrowing in the caliber of that vessel. And this is how carotid disease can be picked up. So what do you do from there? First, medical management. So work with your doctor on modifying your risk factors, getting your weight down, exercising, eating healthier. But when these also fail, you have to add on some medications, regimens. One is really to control cholesterol. And statin medications and other type of medications are prescribed for that. The other thing is to control blood pressure. And if you're diabetic, controlling blood sugar is very important because that damages the blood vessels everywhere in the body. And when medical management is not enough, somebody's still having symptoms, there are 2 other options. One is a surgical option called carotid endarterectomy. I'm not going to talk about this option today. I'll talk about our second option, but let me describe to you a bit. This is a process by which there is actual surgery, opening to the blood vessel of the neck, putting the artery aside so it doesn't get damaged, physically removing the plaque, and then suturing it back up. In a less invasive manner, I'm going to talk to you about the endovascular way, or treating within the blood vessels, called angioplasty and stenting of the carotid artery. And in this method here, you see the plaque. We put different kinds of wires and different kinds of catheters, which are basically hollow tubes, to allow us to get to the blood vessel of the neck. I'll show you in greater detail on the next slide, but what you can see here is a cartoon picture of a protection device. It acts as an umbrella. Basically, as we're trying to manipulate and treat this area of narrowing, we don't want any plaque to break off and go to the blood vessels of the brain. So we use this as an umbrella to catch any plaque. Next, we will inflate a balloon to kind of squeeze the plaque or open up a way for us to kind of permanently keep the vessel open. And finally, we will deploy something called a stent, which is a metal mesh type hollow tube, and that acts to keep the blood vessel open. I'm going to show you some images of that in a real patient, what it shows like on the next few slides. But where does this happen? So this happens in something called the angiography suite. This suite, based on fluoroscopy or X-ray beams, we're able to see the inside of the blood vessels when we inject contrast in it. Basically, you can think of it as injecting Jell-O in a Jell-O mold, or putting Jell-O in a Jell-O mold. That Jell-O will take the shape, and that's how we see. The shape of the blood vessels is inferred by the contrast that contours the vessel when we inject it. We do this again in a very minimally invasive way. I'll explain what that means. We either go in through a blood vessel in the leg called the femoral artery, or we're also able to go through blood vessels of the wrist or of the arm to be able to have access to all the blood vessels of the neck and brain. And we travel our way with these catheters and wires I told you about. And once we have access there, now we do the treatment. So let me tell you that for carotid angioplasty and stenting, though, you must be able to be on blood thinners. These 2 types of blood thinners. One is aspirin, and one is called Plavix. That will be for some extended period of time. Sometimes that's 3 months, sometimes closer to 6 months, and then expect that you're going to be on aspirin lifelong for most people. And here are the protection devices, these umbrellas I was telling you about. They act really just to make sure no plaque goes up to the brain while we're treating. And here's an example of one of the type of balloons we use to crack open that plaque and give us space. And finally, 2 types of different stents that we use. So let me show you some pictures of what we would see in this angio suite, how we would see images. So here's the injection of contrast into the carotid artery. Here's the main branch called the common carotid artery, which again splits up into the internal carotid artery, feeding all the blood vessels of the brain, or filling the tissue of the brain, providing that vital oxygenation. And here you can see the blood vessels which are filling to the head and to the scalp. And in this example, you have narrowing in the external carotid artery going to the face and to the scalp. So that can happen. It can happen either in the internal carotid part, in the external carotid part, or lower down in the common carotid part. And we treat it as we see it. So here's an example of a patient who had radiation to the neck, but also has plaque, also has cholesterol problems. And they had strokes because of narrowing in the internal carotid artery feeding the brain. What do we do about that? Well, we have to secure the plaque and we have to open up the space. And so what you see here under X-ray, here where the teeth of the patient is, here's the chin, and here's the area of the shoulder. And this is our tube. You see here striated. This is how we get there, our catheter. And this wire is carrying our umbrella, our protection device called Spider. That's going to catch all the plaque like I was talking about. And here you see these two little white dots. These are actually showing us where the length of the balloon is, so we can target it appropriately over the area of narrowing. And what you see in this last image is the balloon inflated, now cracking open the plaque, so we can be able to deliver the stent. So next, through the same catheter, through the same tunnel or tube, we are delivering the stent. And here's the stent being opened slowly, and finally being opened and released into the blood vessel to keep it open. And here's what you see afterwards. So here the stent extends from here all the way to there. And if you see the before and after, you see plaque here and narrowing, and after you see a very good caliber to ensure that this patient has adequate blood flow. And as its job is required, this protection device called Spider was able to catch all of this white, tiny stuff, is plaque that came from the carotid artery and did not go to the brain. So I hope with this video series of lecture, I was able to show you and teach you a little bit about carotid disease, not only to understand to recognize signs and symptoms, looking at your modifiable risk factors, how you can improve your health outcomes, and also to be more aware. Thank you very much for joining the series.